Most appropriate initial management of this patient. 52-year-old woman, painless mass in her right breast, family history of breast cancer, firm, immobile mass, upper outer quadrant of her right breast, no axillary lymphadenopathy. Mammogram reveals spiculated irregular mass with calcifications. Core needle biopsy is performed. Malignant cells arranged in a ductal and glandular pattern infiltrating the surrounding breast tissue. Um, so I think she has breast cancer and it's infiltrating the surrounding tissue beyond the mass. So I think we probably need a well, initial management. I always forget on breast cancer. Do we take it out first and then do stuff, or do we do stuff first and then take it out? Um, I think I would start with modified radical mastectomy.
So this is controversial, I would say. This is controversial. Um, so lumpectomy followed by radiation. This is for early stage breast cancer, which this patient has because she doesn't have any lymphadenopathy. Um, Neoadjuvant, right, will shrink the tumor, make it easier to remove. So that's why I said it's kind of controversial. They probably won't test this because this gets really heavy into breast cancer, right? But it's usually for advanced cases, so really big breast tumor or breast cancer that has metastasized to the lymph nodes. So neoadjuvant just means before, like treatment that is before the definitive treatment. That's what neoadjuvant means, if that makes sense.
Yeah.
So let's say you're planning for a lumpectomy and a followed by radiation. That's what's in cancer. That's considered your primary definitive treatment, right? So neoadjuvant means before. If you have if it's called adjuvant treatment, that means it's after your definitive treatment. Does it make sense? So for instance, like if you say, "Oh, I want to do a lumpectomy," followed by adjuvant radiation or followed by radiation therapy, right? That means the radiation therapy is adjuvant treatment, right? So neoadjuvant is before. So what I say is, the reason why I say this question is a little bit controversial is because some people might say neoadjuvant chemo if it's big enough, right? They don't give you a size, right? Things like that. But best answer here is going to be lumpectomy followed by RT in this situation because it seems like it's small enough, it's isolated, there's no lymphadenopathy. So you can go to surgery and then followed by radiation. But it's a good kind of topic to discuss because all modified radical they try not to do so much because you're taking a lot of tissue, right? Neoadjuvant they can consider, and then immunotherapy is something that they consider also, which you target the receptors that the breast cancer responds to. So all these are possible answers, I would say. So a little bit controversial, but kind of a good question to talk about kind of the general concepts of cancer.
Yeah.